Welcome to our weekly update of the City of Brampton's COVID-19 efforts to combat this virus. I'm joined today by Dr. Lawrence Lowe, our Medical Officer of Health, and also this week by Derek Boyce, who's our Commissioner of Recreation. So a few updates. As you know, we've entered the grey lockdown stage, and we're doing our best to maintain city services in this new zone. You can book appointments at City Hall now, no walk-ins, just online appointments can be booked at brampton.ca/skip-the-line. And we'll have updates about these 28 days regularly and what services are still available on our city website. We had our GTHA Mayor's meeting on Monday, and one thing I want to underline from that meeting is that we've agreed to collectively advocate for sick benefits. It's an issue that is really a missing link when it comes to the pandemic response. Too many of our vulnerable workers who are in essential trades are frankly going to work with symptoms. It leads to household spread. If you want to have a sophisticated pandemic response, sick benefits has to be one of the components. We can't have people having to choose between going into work with symptoms and making their rent payment or putting food on their table. We need to have proper support. And I know Mayor Tory has spoken about this and Mayor Crombie, and I can certainly attest that it's a significant issue in the city of Brampton. It will be a big boost if we have that tool in our pandemic response. In terms of bylaw enforcement, I would note in the past week there was 13 charges laid under the mandatory face covering bylaw, only 4 charges for the reopening of Ontario Act. So we are seeing a high level of compliance with the recommendations of public health and the new provincial orders. We do have some good news this week. I know we talk a lot about the bad news. But we do have some good news. We've tried to adapt in Brampton to these new conditions, and we know that indoor recreation has been closed. But we also know that cardiac issues, rising rates of obesity are challenges in our society, particularly in Peel Region. We also know the mental health benefits from physical activity and active lifestyles. And so for the last month, our recreation team has been working on creating safe activities outdoors and getting guidance from public health. We are going to bring out a slew of amenities like the city's never seen before for ways that you can be active outdoors in a safe manner consistent with the guidance of public health. And so today, the city is launching our Winter Wonderland. Across the city, we are opening new winter amenities, and I'm really excited about this because we're going to be having some safe winter amenities like we've never seen before. So just to mention a few, we've launched our new bike lanes and backyard garden program in the summer. That was the first step in encouraging outdoor activities, but now we're going to have a number of outdoor winter activities, and this includes 4 new ice rinks, 4 new artificial ice rinks, new outdoor cross-country skiing and snowshoeing trails. So if you don't like hockey and pleasure skating, you can pick up cross-country skiing and snowshoeing at Shinkuzi Park. We have festive and guided walking tours through our trails, which are going to have winter maintenance, enhanced winter maintenance. The 4 new ice rinks will be located at Valley Brook Park, Earnscliffe, Jim Archdeacon, and Flower City Community Campus. Right now, it's scheduled to open December 18th, but the goal is to get them open up even sooner, maybe even as soon as the first or second week of December. So this is something that I'm very proud of because I really believe we have to give people outlets for activity. And I know it's tough right now. You know, everyone being cooped up in their homes, following the advice of public health. You know, everyone wants to do their part, and we thought it was important to create outdoor activities that you can enjoy with your family. Certainly, there can't be any large numbers at these outdoor venues, but as long as we follow the advice of public health, these are amenities that I hope the city will enjoy. On a testing update, William Osler has administered 284,374 tests across all of its sites, including Brampton and Etobicoke. Currently, there are 36 COVID-19 patients at Brampton Civic. 9 of those are in ICU. And the last thing that I want to mention is we have continued to lobby for our isolation center in the northeast of Brampton that has been hardest hit in the GTA. City Council passed a motion unanimously asking for this isolation center, and we have made another formal request to the Federal Minister of Health, Patty Haydu. Just like sick benefits is an important component of the pandemic response, we believe an isolation center within the neighborhood of where we're hardest hit is also an important component of that response. And I just want to underline that despite the fact we're in the gray zone, despite the fact that we are in a lockdown, the 2 largest sectors in Brampton are transportation logistics and food processing. So the major segments of our workforce are not shut down. They're in full operations. And because of that, it's not as simple as thinking the numbers will go down over 28 days. If we have sick benefits, if we have an isolation center, those are tools that will help us deal where we've really had significant outbreaks. We've had, the last I checked, 126 workplace outbreaks in Peel Region, and there has to be an appreciation that we have residents that are in difficult conditions where there is enhanced risk because of their work. And as I've said many times, if you go to a grocery store, whether it's from Chilliwack to Charlottetown, you need to thank likely a Brampton worker. If you use Amazon to order your holiday gifts, you need to thank a Brampton worker. These essential workers are really rising to the occasion. They take on an enhanced risk, and I can't reiterate enough, we need to have their back, and the way we can do that is with sick benefits and an isolation center. On that note, it's my pleasure to welcome our Medical Officer of Health, Dr. Lawrence Lowe.
Thank you, Mr. Mayor. Good morning. As of this morning, Peel Public Health has investigated 14,782 cases of COVID-19 in Brampton. Of these, 1,631 are active, 13,049 are resolved, and 102 have passed away. With the province returning our community to grey and lockdown, I feel deeply for our small businesses, especially with these measures coming just before the holidays. And on those holidays to come, Gurpurab, Hanukkah, Christmas, Kwanzaa, among others, I also know that not being able to gather as usual weighs on our health and well-being. But we know we must stay apart to protect our loved ones and make sure that there isn't empty seats at the table next year. These measures are coming at the right time. They're an emergency brake designed to immediately reduce in-person interactions and prevent runaway community transmission. We must stop the rising tide of cases and hospitalizations. We are seeing more and more family members and friends wind up in our hospitals, filling our intensive care units and being left isolated and fearful on hospital wards. I have no desire to see Peel or Brampton get added to the list of cities that have seen pandemic misfortune. We know that where COVID-19 has overwhelmed healthcare systems and communities, fear drives closures anyway, and the cost of staying open is also measured in lives lost and changed. We must take steps now in this pause that we've been given. So I ask every resident, only leave home for essential reasons. Work, school, exercise, accessing healthcare, purchasing necessities, or to leave in an emergency. When you do go out, always follow the precautions of distancing, masking, and hand washing. Don't go out if you're sick. Get tested and self-isolate, including from anyone that you live with. Have close contact only with the people that you live with under the same roof and 1 or 2 essential supports. Do not have anyone else over, and please do not hold or attend social gatherings at this time. I want to be clear that this is not a setback. Together, we are protecting each other, our hospitals, our schools, and our long-term care homes. If your livelihood has been impacted by the closures, I urge you to make use of the supports that are available to you, including rebates through the provincial Main Street Relief Grant Program. While these closures will help us in the short term, we must also use this time to target additional measures at the spread of COVID-19 here in Peel. Peel Public Health continues to engage with our community leaders to ensure that advice is being heard by all our diverse residents. We know we need to target disparities because hearing advice alone isn't helpful if your situation does not permit action. We need paid sick days to ensure that people don't feel compelled to work if they should be isolating. We need eviction protection and income supports to provide peace of mind. We need to continue to target essential workplaces for enforcement action around precautions. We are bringing a voluntary isolation center online, and I am in continued conversation with our provincial partners to see how we can reduce barriers to testing. Health equity is local public health's fundamental mission, to create contexts for all to enjoy good health. We have seen similar outcomes and patterns with other health threats in our community, like chronic disease and mental health. This infectious disease, spread from person to person, has reminded us that we are all connected, that none of us are protected unless all of us are protected. Many that have faced COVID-19 have been our community's most vulnerable, our elderly and those that are medically unwell. But many others who fall ill are also our newest and most marginalized community members. They are our frontline heroes that keep food on our tables, packages delivered to our doors, and care going in long-term care settings. They bear the loads and fears that many of us do not. They do not deserve stigma. They deserve our support and our thanks. So even we who are impacted by the closures, and as we support them, let's also not forget that we're also protecting the lives and health of our most vulnerable. Please do your part to be kind, to keep each other safe, and to fight for what's right. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe. And on that note, we're happy to take questions. And I would note that if there's any questions about the recreation plan, we have Derek Boyce, our Director of Recreation here. And if there's any bylaw questions, we do have Paul Morrison, who is our Director of Bylaw. So the first question is Irene from 680 News.
Hi, this is for Dr. Lowe. I am just wondering, almost half of Brampton schools have active COVID-19 cases. Are there any concerns about keeping schools open? Should parents feel comfortable sending their kids to school?
Thanks so much for the question, Irene. As I mentioned in my remarks, schools absolutely remain a priority to remain open. We know that children derive significant benefits from having classes in person, both from their learning and education, but from their socialization, their development, and their emotional well-being. And so insofar as schools are a priority to remain open, Peel Public Health continues to prioritize case and contact investigation in school settings, and also closures of cohorts and schools if and when there is a risk to the school community. Other than that, the important thing is for parents to know that schools remain a priority for our investigations, and that they can continue to send their children to schools with confidence at this point in time, and certainly that we will advise if that situation changes. Thank you very much for the question.
Follow-up, modified stage 2 for Peel went into effect October 10th. Now in the gray zone, the lockdown. With the modified stage 2, we didn't see the numbers go down. Is there hope that the numbers will go down? Are people just not getting the message about the seriousness of this? What needs to happen for the numbers to go down in Peel?
Well, I'll let Dr. Lowe speak to that, but I would just say initially, we are seeing a high level of compliance. In July, we were seeing 120 tickets some weekends. The fact that we are down pretty consistently to single digits shows that really there's been very minimal social gatherings. I appreciate the buy-in of residents. I would say that I continue to believe that the elephant in the room is the abundance of essential workers we have in Brampton. And, if Canadians are willing to give up having food in the grocery stores and being able to order their goods on Amazon, you shut down those sectors, maybe you could see numbers go down more dramatically. But if they're not willing to, then we need to make sure we have that isolation center and have those sick benefits. It's one thing to have restrictions across the board, but it really should be compounded with supports for a setting where we've seen significant transmission in Brampton. And I know that there is a big push on right now to the federal government to have those supports.
Yes, thank you, Irene, for the question. And so certainly, as Mayor Brown identified, I think there's two things that we need to be very clear about as we move into the grey lockdown phase here in Brampton as well as throughout the region of Peel. For those of you who can reduce your discretionary in-person contacts, please, this is the time to do that. So limit your close contact to being home, work from home, make sure that you're only meeting in person for an essential reason, and making sure that you're always taking precautions when you're out shopping, when you're at work, etc. We do recognize, and as Mayor Brown has identified, that we have a significant number of our residents that are unable to work from home, and that may be precariously employed or challenged by other socio-demographic factors. And it's for those reasons that in my remarks I've highlighted the need for us to use this pause to also put in place additional supports that will ensure that everyone is protected against COVID-19, because that will, because while the grey lockdown piece is an emergency brake that allows us to get contacts down really quickly, we know it's not ultimately sustainable over the long term. So we need to take the opportunity now, while the numbers are starting to hopefully come down, to also address what we're seeing amongst the most vulnerable in our community. Thanks for the question, Irene.
Okay, the next question is Nitin Chopra from Prime Asia TV.
Good morning, Mayor, and good morning to all. My question is for Mayor Brown, and if Paul Morrison can also add into this. In Peel region, since we are into lockdown, and many small businesses have serious concern. Yesterday, when we visited them, they called us. Their concern is very serious. When they said they have a 6,000 square foot of area, they have 27,000 square foot of stores, and they are not allowed to open for public. Their concern is that when car dealerships can open in Peel, which are not essential, with appointment. So their request is, if you can take this with the province also, their request is that if they are allowed to open with appointment, at least that it keeps on running, economy keeps on running, and they will survive in that way. What do you have to say, Mayor?
Well, and I'm not sure Paul can speak to that, because it's a provincial order requiring these businesses to shut down. The city will follow and implement the provincial orders and restrictions, but in terms of what businesses were picked and which ones weren't, that was decided at the provincial table. I would say that I have raised it with the Premier. I know I've had a number of small businesses ask me, a small retail store, why are they closed yet the Costco is open, that has a much more crowded environment. And so I know those are issues that the Premier is weighing. I know he mentioned that the rollout in Manitoba had problems when they tried to segregate what was sold in the big box stores. But my heart goes out to these small businesses, because I feel it's a real kick in the gut to them, and we're going to continue to raise their plight with the provincial table. I know something that Dr. Lowe has said many times is that supports need to come. And I certainly agree with that. We need to have supports for our small businesses, because I am worried that we're going to see a number of bankruptcies. We have to do the right thing by public health, but we can't lose sight of the fact that this is an economic disaster as well, and it's really hard on small businesses. Nitin, is there a follow-up question?
Yes, follow-up is yes, this is a provisional issue, and in this case, the stores I am mentioning, they are furniture stores, they are appliances stores, they have a 30,000 square foot of area, whereas the car dealerships, if we compare, they are also not essentials, but they are allowed to open with appointment. So that's a serious concern, because we talked to province also. That's why this is a Peel region businesses, because they asked to they have this serious concern, like they should be allowed to open with the appointment. That matter can be taken with the province, Mayor.
Yeah, we can reference that to the province. Maybe Dr. Lowe would like to speak if he's had input into the provincial table that has made some of these decisions in terms of a car selling cars or automotive assistance versus a small business with a large square footage.
Yes, thanks, Mayor Brown. Thanks, Nitin, for the question. I did, along with the Peel Public Health team, have the opportunity to provide recommendations for consideration with the Chief Medical Officer of Health around additional measures that were needed to be put in place here in the region of Peel. Many of those measures made their way into the provincial framework subsequently, and the recent decision to move. However, motor vehicle sales as well as large square footage, those were not elements of my recommendations to the province. What I will say is at this point in time, really, what we need people to do is try to reduce their discretionary contacts as much as possible. So I think there's still this ongoing conversation and focus on what's open, what's closed, where to go, etc. The key message to everyone at this point in time, now that we're in gray lockdown, is limit your close contacts as much as possible to the people that you live with, and only meet in person outside your home for the most essential reasons. Thank you very much for the question.
Okay, next question from the pointer.
Hi, good morning. This question is for Dr. Lowe. Are workplaces cooperative with Peel Public Health in investigating outbreaks? And as far as you know, cooperative with investigations conducted by the Ministry of Labor that you called for back in October?
Yes, thanks so much for the question, Nita. We do continue to work very closely with our Ministry of Labor partners. My understanding is that workplaces in general are very compliant, but there are many workplaces in the region of Peel, and at this point in time, we are working with our Ministry of Labor partners to figure out what's the best way to ensure that we are protecting individuals in high-risk sectors. This also really speaks to the importance of owners and operators of high-risk industries to take seriously the provisions of the recent Class Section 22 order that Peel Public Health issued, as well as just the general exhortations throughout this time. Protecting your employees, providing them with paid sick leave, these are ways that you can protect not only your employees, but also your community and your staff, your community and your business during this difficult time. So I think there's a number of layers of responsibility here, Nita, but to the extent that many workplaces have been working with us in outbreak investigations, we've been grateful for that, and certainly there are others that have not, and that is where our Section 22 comes in. Thanks for the question.
Great. Thank you. And this next question, Mayor Brown, is for you, but I'm hoping Dr. Lowe, you can also talk a little bit about it. Mayor Brown, on Monday you tweeted the industrial settings are the greatest area of COVID-19 spread in Brampton and Peel region. Yes, workplaces have been a source of outbreaks, but looking at the data from the latest epidemiological update, outbreaks linked to households or the community far outweigh outbreaks linked to workplaces. So I'm wondering if there are cases occurring in workplaces that are for some reason not deemed outbreaks, but maybe contributing to cases in households or community.
So if you look at the data that was shared widely with the public, it showed in Peel region that the largest source of transmission was in industrial settings. And I would highlight that this is very much linked to household spread as well. So if you have an essential worker, someone in precarious employment, and they get COVID and then they go back into crowded living conditions, it can spread very quickly. And so it's why our push for sick benefits and an isolation center are so critical, because these are undoubtedly linked, and I'll ask Dr. Lowe if he wants to speak to that as well.
Yes, thanks, Mayor Brown. Thanks, Nita, for the question and the opportunity to clarify data. The weekly epidemiologic update represents the proportions of acquisition by case, and in respect of the proportions of when we're talking about industrial settings, that is a different data set that speaks to the number of outbreaks that we're seeing. And so outbreaks, as you know, not all cases are linked to outbreaks. So these are two different data sets, and in the weekly epi summary, you're looking at, for each individual case, what was their most likely source of acquisition, in which you are correct, households do tend to be a significant source of acquisition. But in terms of transmission through outbreaks, then you're actually looking at where these transmissions are occurring in our community. Outbreaks represent a subset of all our cases, and yes, industrial settings are our most significant settings. So in essence, the data that you're describing are two different sets of data. Mayor Brown's assertion around transmission in outbreak settings is correct around industrial settings, and that is why we have focused on high-risk workplace settings. And you're correct that for the vast majority of cases, the acquisition does occur in households. So again, important to keep the two different sets of data separate. Thank you for the question.
On that note, I want to thank everyone for the questions. Thank you for tuning in to our weekly COVID-19 update. Stay safe, stay healthy, and please listen to the advice of public health. There is light at the end of the tunnel. We know that there's great progress with vaccines, and we just need to get through the next few months. So everyone, please be cautious and safe.